in recent years, the shortage of registered nurses in the United States has drastically increased. The U.S. Department of Labor predicts that employment of registered nurses is expected to grow 23% by 2016, with 587,000 new jobs. These new jobs will be driven in part by advances in patient care, an increased emphasis on preventative care, and an aging population. However, studies show that there will not be enough RNs to fill even one-third of these positions. With an increase in healthcare jobs accompanied by a decrease in registered nurses, the outlook for the state of healthcare in the United States is not promising. According to a report conducted by the Health Resources and Services Administration, 30 states are currently suffering due to a lack of nurses being able to fill positions. Nearly 90% of long-term care facilities do not have sufficient staffing to provide even the most basic care, and home health agencies are being forced to refuse new admissions. Currently, there are 1.1 million unfilled positions across the country, a number that is expected to reach more than 2 million by 2020. Nursing shortages in the United States is related to a range of issues. The current nursing shortage is connected to demographic changes, fewer acceptances into nursing schools, registered nurses who are retiring or leaving the workforce, and a growth in demand for healthcare services as the baby boomer generation ages. Nursing school enrollment is not growing fast enough to meet the projected demand for registered nurse services. The American Association of Colleges of Nursing reported a 2.6% enrollment increase in entry-level baccalaureate programs in nursing in 2013. Although this is an increase from previous years, the increase is not sufficient to meet the projected demand for nursing services. With the passage of the Patient Protection and Affordable Care Act in 2010, more than 32 million Americans will soon gain access to health care services, including those provided by registered nurses. A shortage of nursing school faculty is restricting nursing program enrollments. According to a report on 2012 through 2013 enrollment in graduations and baccalaureate and graduate programs in nursing, the United States nursing schools turned away 79,659 qualified applicants from baccalaureate and graduate nursing programs in 2012 due to insufficient number of faculty, clinical sites, classroom space, clinical preceptors, and budget constraints. Almost two-thirds of the nursing schools responding to the survey report pointed to faculty shortages as a reason for not accepting all qualified applicants into their programs. The significant segment of the nursing workforce is nearing retirement age. According to a 2013 survey conducted by the National Council of State Boards of Nursing and the Forum of State Nursing Workforce Centers, 55% of registered nurse workforce is age 50 or older. The Health and Resource Services Administration projects more than 1 million registered nurses will be reaching retirement age within the next 10 to 15 years. Changing demographics signal a need for more nurses to care for the aging population. According to the July 2011 report, a serious shortage of nurses is expected in the future as demographic pressures influence both supply and demand. The future demand for nurses is expected to increase dramatically as the baby boomers reach their 60s and beyond. According to a May 2011 report released by the Nursing Institute at the University of Illinois College of Nursing, the ratio of potential caregivers to the people most likely to need care, the elderly population, will decrease by 40% between 2010 and 2030. Demographic changes may limit access to health care unless the number of nurses and other caregivers grows in proportion to the rising elderly population. In response to the shortage, policymakers have enacted new legislation to provide funding for nurse education, recruitment, and retention on both the federal and state level. On the federal level, as part of the 2009 American Recovery and Reinvestment Act, funds have been allocated to enhance the nation's healthcare workforce, which includes the nursing profession, by providing funding towards professional training and education. The U.S. Department of Health and Human Services funded the Nurse Education Loan Repayment Program totaling $8.1 million. The program helps registered nurses pay their school debts. 60% of their loan debt can be paid off in exchange for 2 years of work in facilities that are experiencing critical shortage of nursing staff. Those who work for an additional year are eligible for more loan payment. Efforts to address the nursing shortage has been seen in a number of states. Georgia, Colorado, Minnesota, Nebraska, and Texas have made efforts to alleviate the shortage of nurse educators. Maryland, Utah, Kansas, and Illinois have passed legislation to address the issue of shortage over the next 5 to 10 years. Many states have also responded by creating programs to increase the level of nursing staff. These programs provide scholarships and loan forgiveness or repayments to eligible nursing students. For example, the state of Maryland awarded grants to several nursing academic programs in 2006 through its Health Services Cost Review Commission. Funds were allocated to the Nurse Support Program to provide grants in order to increase the number of nurses in Maryland hospitals as well as to attract more nurse educators. In 2009, academic and healthcare leaders from 47 states gathered in Baltimore for the 2009 Nursing Education Capacity Summit to help identify and advance strategic solutions to the nursing shortage. The U.S. Department of Labor shared best practices related to strategic partnership and resource alignment, including the partnership with neighboring countries. Institutions are doubling their efforts to attract and retain nurses through these partnerships. To that end, foreign nurses are increasingly being sought. During the past 50 years, the United States has regularly imported nurses to ease its nursing shortage. Although the proportion of foreign nurses has never exceeded 5% of the U.S. nursing force, that figure is now slowly rising. The Philippines has dominated the nurse migration pipeline to the United States. Indeed, until the mid-1980s, Filipino nurses represented 75% of all foreign nurses in the United States nurse workforce. Their representation has dropped to 43% by 2000, as more countries began sending nurses abroad. In the late 1990s, nurse migration to the United States increased. In 1995, nearly 10,000 foreign nurses received their United States RN license, representing almost 10% of all newly licensed RNs. In 2011, the reported number of foreign nurses receiving their United States RN license has increased to nearly 30,000. Upon coming to the United States, foreign nurses are employed in an increasingly diverse array of settings. Foreign nurses are employed in hospitals that are in need of registered nurses. Recently, foreign nurses have been employed in colleges to provide education to students enrolled in nursing school. Experts hope that the use of foreign nurses in education will help increase the enrollment rate of students in nursing schools in the United States. Nursing shortages in the United States continue to rise. In future years, experts predict that the nursing shortage will continue to victimize the medical world. The nursing shortage the United States is facing has caused healthcare practices to diminish. Thousands of Americans are affected by the nursing shortage. Policymakers at the federal and state level must work to end the nursing shortage and begin to build a better outlook for the future of the United States healthcare.